glad to have you back with us, talking a little bit more about the support that Aetna can provide to Virginia counties. Since healthy communities are so important, let's discuss community health. How does Aetna's holistic approach to care and health equity impact communities in Virginia?
That's a really good question, Dean. And we've talked about how we support the health of employers and employees, but we're equally as committed to supporting the health of local communities, regardless of whether or not they're Aetna members. And there are really three key components that we focus on out of many in Virginia, including affordable housing with significant investments over time, workforce initiatives with many active partnerships and commitments, and free health screenings using our CVS stores and mobile screening units. And these investments are all used to address common barriers to people's physical health and mental health. If you're unable to afford housing, unable to find good employment due to lack of skills training and lack of opportunity, and can't afford health care, it makes it extremely difficult to focus on one's health and manage chronic conditions. So providing support in these areas is vitally important to the overall health of the community. And I'll start with affordable housing. And as you can see, we've made over $50 million worth of investments in affordable housing units throughout many parts of Virginia, including $2.7 billion worth of investments in affordable housing over the most recent 3 years. On a national basis, we've invested over $257 million in affordable housing in 2022. And have invested $1.4 billion in affordable housing since we started down this journey many years ago. So you can see the significance of what we do and why we do it. And we don't just invest and walk away. These are long-term investments, typically 15 plus years, and we carefully select strategic partners to maximize the health and well-being of the residents and the greater community. And we'll continue to partner with local communities and the affordable housing team to make these investments in the future. Along with affordable housing, CVS has also been providing workforce programs for more than 20 years now, and has helped more than 115,000 people across the country transition from public assistance to careers at CVS Health. In addition, over 1 million young people have been exposed to careers in pharmacy. And in some locations, we even have workforce training centers that have provided trainings for thousands of individuals. And workforce initiatives are so important because they can help break the cycle of poverty and help unlock so much potential for individuals through creative partnerships. And as you can see here, we focus on many different populations with workforce training, with targeted programs for each: the youth, aging workforce, people with disabilities and abilities, military veterans, past offenders, and faith-based organizations. Our workforce team is very active throughout Virginia, and we'll be happy to connect with counties to talk about their workforce needs, and more importantly, develop solutions to help meet those needs. And then last but not least is our focus on providing free healthcare screenings for underserved communities throughout Virginia and throughout the country. And we call this program Project Health. Essentially, it hosts in-store events at select CVS stores and brings our mobile RV unit to underserved communities at affordable housing units, homeless shelters, churches, and CVS store parking lots. These free health screenings help to improve access to healthcare and ensure that cost is not a barrier to important preventive services. Since launching Project Health in Virginia, we've hosted more than 85 events with more than 4,000 screenings completed throughout the state. And right here on the right-hand side, you can see our most recent slate of screenings in Virginia toward the end of 2022 using our mobile RV unit.
Marcus, I'm really excited about the support that you provide to Virginia's communities, especially our counties in Virginia. Can you give me a couple examples of the actual support that that you've been working with some of the counties or the cities in Virginia?
Sure. We've had several conversations with many workforce training partners throughout the Commonwealth. Our most recent partnership took place in Richmond, Virginia, where we brought in a mobile RV unit and completed many screenings throughout the Richmond area over multiple days to really, number one, make sure that people had access to healthcare in their communities. Number two, make it more convenient. And then number three, ensure that the services that we provide are at no cost. We don't even ask if you have insurance. As a matter of fact, most of the people who came in to have screenings done did not have insurance. And the other part is that after the screening, people who come in are able to get some consultative support, meaning that when the screening is done, the people that we use to provide the screenings can help connect them with providers in their own community, and typically no cost to low cost providers that can help, again, bring them access to affordable care where they live and where they work.
Hey, Marcus, when speaking specifically about this Richmond project, did you work with the elected officials and with the administration, maybe the city administration, on where to host this at, looking for high priority areas of the city?
That is part of what we do, Dean. Anytime there is an opportunity to provide screenings in a locale, whether it's a county or a city or a state, we do partner with elected officials to, number one, bring awareness to the screening event so that that elected official can use their platform, whether it's their website, whether it's a town hall or a radio ad, to make sure that people are aware of the services that we're bringing to their community. So that is a part of Project Health, is working with elected officials and also community leaders to bring those health screenings to the communities that are in need.
Marcus, I think in previous discussions that you and I've had, you've mentioned that Hanover County is one of the counties that you all are providing some services to and support for. Can you tell me a little bit more about your work in Hanover County, and what were the determinants that Hanover was looking at in trying to support healthcare with their employees?
Sure. Good question, Dean. I can say, having worked with Hanover County, they really, really care about their employees and really care about how their employees access and experience their benefits. And one of the good things about that, the NCVS, is that we offer a very broad range of services. And we were very fortunate to be able to partner with Hanover County and Hanover County schools and library as well, since they all purchase insurance together as somewhat of a consortium. But we were able to partner with Hanover County on their medical benefits, their pharmacy benefits, their employee assistance program, including the first responder health program that I talked about previously, and the dental benefits as well. So really being able to provide a full suite of services for Hanover was important. They also valued simplification, being able to have, one account team, one single point of contact for all benefits really helped to ease administration. Being able to have one contract with one carrier was really, really important to them. And the other piece was making sure that we provided on-site support, whether it was throughout open enrollment, whether it's providing on-site support for the biometric screenings that they do on-site at various locations throughout the county. Just really, really a great partnership. We do value their feedback and take it very seriously, but it's been a really fun opportunity to provide a full suite of services and support for Hanover County schools and the library as well.
Marcus, we thank you for spending time with us today. And it was great. And it's also exciting to hear about the vast array of products that Aetna has to offer our communities. We value our partnership and appreciate your participation in this VACo Premier Partner Spotlight Series. Thank you
so much, Dean. To you and your entire team at VACo, it's been a real pleasure partnering with you. And we're so excited to continue supporting you and Virginia's counties going forward.
Thank you, Marcus.
Thank you, Dean. Take care.